It was early last year. I just went to the hospital for a wellness checkup. I was not sick, but because as a missionary, I was preparing to go back to my mission land. I didn't have any signs and symptoms of any cancer. And when the results came out, it showed that I had a lump in my left breast. My world crashed. Initially, I was at that denial stage. It can't be, it's not something, I'm not sick. I was not sick. I wasn't sick, but I had a cancerous tumor in my body growing without knowing. So this could be anyone could. I've seen children with cancer. Cancer is real and anybody can get cancer.
Absolutely.
So those who say that what you don't know will not kill you, my friend,
it might kill you.
It might kill you. I don't even want to remember what went on because I knew I could see my grave, by the way. And here I am.
And here you are, 1 year later.
Yes, talking about it.
I tell you. Hello, welcome to the One Health Lens podcast, where we have conversations around health and related topics, making them simple and easy for you to understand. I'm your host, Dr. Diana Wangari-Gitau, and today we're having a conversation around cancer, really. And it's a conversation that hits home to most of us. Many people would say, I know someone who's diagnosed with cancer. They'd say, I myself, my family member has cancer. And really, it's not a diagnosis per se, it's a journey. And in studio with us, we have someone who's walked this journey and someone who's supported this journey. I will welcome Sister to introduce herself before Doc introduces himself. Sister?
Hello, everyone. My name is Sister Anne Gathegu. I belong to the Congregation of Missionary Sisters of the Holy Rosary. Yeah, we are missionaries and international.
Karibu, Sister.
Asante.
Daktari?
I'm Dr. Adarsh Chandra. So I'm a clinical oncologist working with HCG Cancer Center. So I deal with both radiation and chemotherapy aspects of cancer.
Karibuni.
Asante.
Sister, what's your story? What's your story?
It was early last year. I remember very well. It was on the 9th of January, 2024. I just went to the hospital for a wellness checkup. I was not sick, but because as a missionary, working as a missionary, I was preparing to go back to my mission land. I had come home for holidays. So I went to the hospital just to do a wellness checkup. I didn't have any signs and symptoms of any cancer, and I went. And when the results came out, it showed that I had a lump in my left breast and no signs, no symptoms. So when I received that email, my world crashed. But initially I was at that denial stage. It can't be, it's not something, I'm not sick, I was not sick. So I went back to the hospital and I met the wellness doctor, and then looked at my results, and she was like, I'm sending you to a breast specialist. And I went there, and the doctor looked at the results, and she told me we have to do more tests. At this point, it has not clicked yet. But when I spoke with her, I went for second and third opinion.
In the same hospital?
No, different hospitals. By this time, I had already communicated to someone, one of my family members, and she was working with me in this journey. So the results came up. It took like 21 days to 1 month. And when the results came, I remember very well, it was on the 14th of February. I'll never forget. It was coincident. Valentine's Day and Ash Wednesday as a Catholic. So for me, actually, there was divine intervention. And the doctor confirmed I had invasive ductal carcinoma. That is the type of the breast cancer that I was diagnosed with. So at that point, nothing was making sense. Only tears, a lot of anger, a lot of anxiety, fear, because what I knew is that once it is cancer, it's a death sentence at that point. And the doctor told me, Anne, you are crying, yes, but for me, as I look at your results, this is good news. And it wasn't making sense. Why? Because it is a rare diagnosis. Because I didn't have the signs and symptoms at all. Thanks for the screening. I thank God. He was there for me. I think it was divine intervention. And it was tough. you can imagine, I had already prepared my funeral, you know, because I knew I was dying. And coming from a family whereby I have seen, my dad died of cancer. So I have seen what it did and what we went through. So I was even afraid to tell my mom and my siblings. How would they take it? And indeed, I told my congregation, the sisters, whereby they supported me 100%. And that is how I started. But the whole world, you know, for me, it's, I don't even want to remember what went on, because I knew I could see my grave, by the way. And here I am.
And here you are, 1 year later.
Yes, talking about it.
I tell you.
I wasn't sick, but I had a cancerous tumor in my body growing without knowing. So this could be
anyone.
Anyone could. I've seen children with cancer. You know, cancer is real, and anybody can get cancer.
Absolutely.
So those who say that what you don't know will not kill you, my friend.
It might kill you.
It might kill you. Yes, but I thank God for the screening that I went. It was caught on time.
Absolutely. Yeah. And we're going to get into then what kind of screening, what kind of treatment you've undergone. But before that, I want to turn to Daktari here. And you're a clinical oncologist. Maybe just explain to us, most people who might not be familiar, who's a clinical oncologist, right?
Yeah. Clinical oncologist, basically we deal with both radiation and radiation aspect of treatment, cancer treatment, as well as medical oncology, like doing chemotherapy as well as doing radiation therapy for the cancers. Yeah. So we deal with both.
Both. Yeah. So the treatment and the medical, like chemotherapy. Maybe explain to us what's the difference, because people would know I've been diagnosed by cancer. What's the difference?
True. Like cancer is mainly there are main three types of treatment. One is surgical, where the surgery is done and that the mass or the cancer is removed. We have chemotherapy, a systemic treatment, where we give cytotoxic materials through the blood as a drip. So they travel through the blood to all of the areas wherever the cancer is there. They will reduce. Okay, that is chemotherapy. That is the medical aspect, medical oncology or clinic aspect of the clinical oncology. The other thing is radiation therapy. Radiation therapy, here we use high dose X-rays, which are targeted at the tumor to kill the tumor. Certain tumors are not removable. In such areas, we give a targeted high radiation, which can damage the tumor there. Okay, and also sometimes we use radiation before the surgery to reduce the size of the tumor to make it operable, or even after the surgery to decrease it from coming back. So in various aspects we give radiation.
So then we turn back to your sister. Yeah, we have an understanding of there are three options. You've gotten your diagnosis, right?
Yeah.
What happens next?
When I got the diagnosis, the doctor, my surgeon explained that I had to go through, she gave me a treatment plan. I had to go through surgery. And my surgery was lumpectomy, meaning the tumor was removed. You know, people always think that if you have breast cancer, they will cut off your breast. No, it's not true. It's not true. So I did lumpectomy. The tumor was removed. And then after 3 weeks, I was sent to my oncologist. And then where she also explained, I went to her actually with a lot of fear, because when I heard that I had to go and do 20 sessions of radiotherapy, I said, okay, this is real death. But
and what had you heard about radiotherapy and chemotherapy before? What had you heard?
Chemotherapy, I knew it is about having your medication through the IV. But radiotherapy, I was hearing nikuchomo. Let me use that word.
Nikuchomo, it's been banned.
Yes. So I had a lot of anxiety and fear. And when I went to see my oncologist, you know, she was like, yes, I know you have anxiety. She asked me, how are you? I told her I'm very anxious. She told me, yes, I know. But as I look at your results, in fact, this is what I want to see as an oncologist. So the thing was not still making sense, you know, like...
The doctors are telling you, this is good. You have cancer, but this is good.
It's good news. So she explained to me, and she was like, you will not even feel anything, but the radiation beams will be going around your breast, under the armpit, and the neck. So, and then my treatment plan, actually, there were 3. I had to go through surgery. I had to go through 20 sessions of radiotherapy, very tough. I couldn't eat and chew and swallow for 2 weeks and 5 days. And then I had to begin doing hormonal therapy, which I'll go for 10 years. I've done 1 year and 2 months. So I have how many remaining? It's countdown.
Yes, it's countdown.
Yes.
It's countdown.
It's life-giving.
I mean, that experience, right? Who's there with you? Because most people, as you're saying, 2 weeks, 5 days, you couldn't eat, right?
Chew and swallow.
You couldn't chew and swallow.
Only take liquids.
What kind of, tell us about maybe who's there with you? What's going through your head? You know, I'm sure the doctor at this point has said, no, this is good, but you're not believing it. I'm not chewing, I'm not swallowing. What is happening around you?
I thank God for the support system that I had. My congregation, they were there because I live in a convent. So the sisters were there, taking me to the hospital, whatever I need, I got. Then come to the medical support team, my doctor, from the surgeon, my oncologist, then the social support. Though that one was kind of, I did not know how, at the beginning, I didn't want to tell my mom and my siblings. But I had to tell those friends that I knew at that point. Maybe they don't know my family, so that they don't break this news, because I wanted first of all to carry it. So, and it was very, very stressful. In fact, I went into kind of a depression, I'll say so. So that support really is the one that helped me at that point. And then at the initial stage, as I said, I had a cousin, my cousin's wife, who was with me at that very beginning, and she was also with me all this while. And that support system is whereby I now focused on what is giving me life, the positivity. If I call somebody and say, hey, I know somebody who died, you tomorrow I will not call. But people who were there for me, and also the spiritual support. I did a lot of prayer networking, because from the word go, I knew there was divine intervention and God was there for me. So that faith and trust in God that he's a healer also played a very big part. And you can imagine, as a Catholic, we believe so much in masses. So hundreds of masses were doing for me. And I believe that they were working for me.
Absolutely.
Yes.
I mean, if we go to the clinical side, and you're familiar with her story, right? Maybe you can now, as say someone who wants to understand, when the doctor is seated across from me and is telling me this is the plan of treatment, right? What is, from a medical perspective, she has said there were 3 steps. Why 3? And what were those 3 from a medical perspective? Yes.
So actually what happens, the breast cancer here, it depends. The treatment will be decided based on their stage, what is the nature of the tumor, as well as when we remove the tumor, we look at some prognostic factors, something in the tumor which tells us whether she requires chemotherapy or not. Like her, she didn't do chemotherapy because her tumor could be hormone receptor positive, and it was in early stage. Okay. So what I want to say is all tumors are not same. Okay. All treatment is not same. Again, we have in breast cancer, we have different types of breast cancers like that. So it's not must for one person, if you get that treatment, if you had that side effect, it's not must that the other person will get it. Okay. So like that, for her, she was diagnosed on screening. So it was a early cancer. She even couldn't palpate, I think. I don't know. I'm not sure. After that one, the surgery, early cancer, we start with surgery. So remove the tumor. We see whether it's a hormone receptor positive tumor. We also have something called targeted therapies available now. We combine with chemotherapy, which will increase the chance of survival, response, and everything. After that one, after surgery, we wait for the wound to heal for 2 to 3 weeks. Then depending on if she is a candidate for chemotherapy, we start chemotherapy and delay radiation treatment. If not, if she is not a candidate for chemotherapy, within a month we start radiation treatment. Here, radiation is given only to the area where it is needed, like the breast. The tumor can spread in breast, it can grow in breast, and it can also, there are something called lymph nodes which are there in the armpit. Okay, They are the first group of lymph nodes normally involved. Then there are some lymph nodes in the lower part of the neck, supraclavicular area, above the clavicle, neck bone, collarbone, that one. So, because when they do surgery, they won't remove that area. Okay, so that's why we include that area when we are treating with the radiation. So the problem, the side effects, the one she explained, normally it can happen in second week. What happens, we have a foot pipe, the esophagus, the foot pipe is just next to that area. So a part of the esophagus gets some radiation which can cause some ulcers. That can cause pain while swallowing.
I want to turn to your sister, right? Because I want to talk about maybe not you, but generally, right? Because it's not just you, it's a story that we hear every single day. What are these other stories you had from, say, the support group or from other people? What are their fears?
First of all, I want to appreciate the support group that I belong to, because we go there and we are sharing stories, I have come to realize that some of these things, like, we are very ignorant. You see changes in your body and you like something very small, which turns out to be really a big deal, a big thing. So the support that I will talk about for me is like, when you're in that group, you encourage one another. And kind of I realized the point, I was not even sick. At this point, I'm like, am I really sick? Because I have gone and seen people who are really sick. And this gave me kind of an inner reflection whereby cancer is not a death sentence. Cancer is not a death warrant. Because I realized that I was out of danger within 6 months. And when I was telling people, they were like, how? Because I was diagnosed in February. 15th of August, I did my first medical review. I was declared free of cancer cells. So early treatment, early diagnosis means early treatment, less pain, low cost. And this one, when I even came to the support group, I used to encourage them that they have been declared free of cancer cells, it can still happen to you. So that positive mind, always telling yourself that I'm more than this cancer. And listening to my doctor's instruction as part of the support. Being faithful to my medication. And I set alarm for my medication. When it rings, one of my sisters will say, hey, it's medication time. So that kind of a support is very important. Like they are journeying with you or they are journeying with me. So this is what I feel that every patient needs. Because when you have that support, and even people reminding my alarm, hey, it's medication time, you know that you are not alone. And in this social support, I realized that you make new friends and you lose friends. Because when people hear of cancer, they start counting for you. How many weeks remaining for her to die?
They think if they touch you, maybe they'll get cancer as well.
Yes, and this is really what people don't know, that cancer is not.
It's not. Absolutely. Absolutely. What would be the screening options that are available, diagnostics, and you can take any approach? I know hers was breast cancer, but what's available? Screening and diagnosis.
Screening and diagnosis. We have, like in breast cancer, we have something called mammogram. Okay. That is a kind of low dose X-rays which can detect the cancer even when it is seen, like even if it is less than 1 centimeter tumor. They can see some early changes which is called microcalcification. Okay, even before it is palpable, they can detect it. Okay, there are earlier forms of cancer called ductal carcinoma in situ. Okay, the precursors, pre-invasive lesions, which can be picked with mammogram, or and we also do something called ultrasound in young women, where we do mammogram after 45 or 50 years, and ultrasound in younger women, so that ultrasound doesn't have a risk of radiation. Okay, and certain patients who are high risk of having cancer, we also do MRI for the breast, which is also it doesn't involve any radiation. Okay, because radiation itself is one of the risk factor for developing cancer. So apart from that, we also have some tumor markers test, like for the prostate cancer, we have something called PSA test, where normally we have PSA stand for prostate specific antigen. it's a marker we check. It's just like a blood test for sugar or any other thing. Checking hemoglobin. Normally, normal people, the range, there's a normal range up to 5 or 6, depending on the age. Again, it can vary. When it is increased, it also gives a clue to check for what's going on. Like normally, it is advised after age of 50 years. Those who are at a higher risk of familial prostate cancer, we start early, maybe from 40 or 45 years. Okay, so we don't have screening for all the cancers. Okay, because it is when we do when we use a screening test, any screening test is advised, it depends on the cost versus the benefit it is giving. Okay, those who only, like, we have also for the prostate, I told you, for the prostate we have colon cancer, again, where we see, it's a stool test where we see blood stains in the stool. Okay, it's called fecal occult blood test. Okay, where we see the blood stains, whether is there any bleeding from the colon. Sometimes, rarely, some patients can get colonoscopy. There are certain hereditary syndromes where routine colonoscopy is advised, where they inherit certain mutations which is prone for developing cancer. If they have that one, routine colonoscopy is advised, just to prevent rather than preventing, early diagnosis and taking the treatment.
I want first of all to affirm what he said about Faraja Cancer Support Trust. I have benefited from that because I go there for complementary therapies, such as some days we go for yoga, sometimes we go for Zumba dance. I think all cancer patients, they should know that there is this Cancer Support Trust. It's really helpful and everything is free of cost. I would say that cancer, for me, what I've gone through is not a death sentence. People should know their bodies, and if you see any change, please go to the hospital. And even if you are not sick, have your annual checkup, medical checkup, because you may be like me, having a cancerous tumor and you don't know. So that medical checkup through the divine intervention actually saved my life. And also, experience makes people change. What I went through and the support I got, I've encountered people who really need support. So I find myself like wanting to be there for people. Like every Friday I volunteer to go to KNH, Kenyatta National Hospital, on oncology, what to be with children with cancer, because people really need people to be there for them. And recently, actually, to say this, that it touched me, it was on a Friday. I went and met, I would say my friend now, because he himself had brain cancer or tumor. He went through treatment, but he fell inside fire during the treatment and his hands were amputated. So I'm actually looking for people to help the man to get the prosthesis of artificial hands, and this is the result of brain cancer. So how can I help this person who has gone through this cancer treatment, but he's okay now? So
it's a journey.
It's a journey, and people are really suffering. So, Dr. Diana,
how are we helping having these conversations? Yeah, Dr. Final word.
I think instead of keeping quiet at home, it's good to go to the nearby medical center. Okay, depending on their availability, location, their financial thing, they can get it checked. I think there are many cancer centers now. There, even in Mombasa, they have started all the chemotherapy and services. Even radiation centers are coming up. There is Wajir, there is a center. In Nakuru, there is a center. Mombasa, there is a center. Okay, apart from Nairobi.
Yes.
Previously, the radiation center, most of them were in Nairobi. But those who require advanced treatments, they are available, most of them in Nairobi. Okay, I think awareness is important. Awareness, and again, discussing with the family. Okay. Getting know about their body, their cancer, that is important. Early screening, going for the regular screening. Prevention aspects, again, having a healthy lifestyle, regular physical activities, all those are very important. There even cancer vaccines are available for cervical cancers, getting vaccinated, the young girls around 10 to 12 years, before they start their sexual activity, it is important to get them vaccinated with HPV vaccine. All patients may not need chemotherapy. Early stage like her, if hormone receptors are positive, there is no need of chemotherapy. She will be put on oral tablet, which has very minimal side effect. Okay. Again, advanced stage breast cancer, if they're hormone receptor positive, simple oral tablet, the same tablet she's taking, can help her to prolong. It can do the thing. If they're not willing for chemo, we don't do chemo. We put her on oral tablets. There's a treatment available which is less toxic, affordable, and they can take, and which is quite effective. Okay. So that has to be done. Like I have many patients, I wanted to tell that message that don't come and discuss with the doctor. Talk, express your concerns. So the treatment will be, no, we can't force a patient any treatment. Okay, we have to take their confidence. If they're agreeing only, we'll advise, and otherwise whatever is suitable for them, we'll advocate.
Absolutely. I like that. I like the fact that from your sister, I'm hearing the call for screening, because if it's caught early, you have better chances, right? From you, Daktari, I'm hearing that not only is it not a death sentence, but there's an option for it to be a discussion based on circumstances, right? Your environment, your support groups, so that then if you require more support, that can be provided. I'm hearing there's a trust as well. In case, you can't meet some of those costs, there can be support. But fundamentally, you should not sit at home.
Yes.
You should not say, I've been diagnosed, let me look for another option. First, come forward, have this conversation. There are people who are willing to support you. Is that right, Doctor?
Correct. True.
And advances in Kenya, that it's not just we must fly out of the country to get care. The advances that are coming day in, day out, and we are making them accessible here.
Yes, true.
Okay, thank you so much. And we'll continue. Sister, I heard your message. We'll continue. And thank you so much for making the time as well.
Thank you.
Asante sana. And asanteni for joining us on the One Health Lands podcast. We'll see you next time.